The coronavirus is influencing the emotional well-being of a great many Americans. COVID-19 is taking an especially hard cost for those battling with emotional well-being conditions like nervousness, OCD, and substance misuse. This is what the specialist state can assist you with: adapting or care for friends and family who could be influenced. Social removing, cover setup orders, eatery terminations. The world we as of now live in has become an extremely peculiar and tempestuous spot. Coronavirus has changed all that we contemplated our day-by-day lives, our legislature, and our well-being into a sort of strange existence where FaceTime dating and frenzy purchasing bathroom tissue are the new standard. It's negatively affecting even the most hopeful of us as we attempt to remain positive in the midst of what feels like more somber and more hopeless news every day. Presently, envision how this previously disrupting circumstance feels for the more than 45 million Americans with psychological maladjustment. Those experiencing tension, sorrow, PTS, substance misuse, and different types of ceaseless psychological maladjustment are probably the most powerless right presently as far as depression, detachment, and potential for pointless conduct because of an absence of reliable help and an upset daily schedule. With an end goal to help those with dysfunctional behavior and their companions and friends and family who might be worried about the effects COVID-19 might be having on them, we address the specialists on the particular difficulties those with the most well-known conditions face, just as what activities they can practice and systems they can access to stay solid and safe. What do we think about COVID-19? For something that is messing so seriously with basically every part of our everyday, there are still a great deal of inquiries and misguided judgments encompassing coronavirus. Before we jump into the particular cost it is taking on psychological maladjustment, here are a couple of key realities we as a whole need to think about the worldwide pandemic. SARS-CoV-2, and the ailment it causes, COVID-19, regularly alluded to as coronavirus, is another sort of infection that researchers accept began in December 2019 in the Wuhan territory of China and has since spread to each landmass, put something aside for Antarctica. Every one of the 50 expresses, the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands are announcing cases, says the CDC. As of March 25, there have been 416,686 cases and 18,589 passings detailed universally. In the US, those numbers are 54,453 and 737, individually, and expanding every day. Coronavirus presents as an upper respiratory sickness with manifestations like pneumonia. You can become symptomatic somewhere in the range of 2 to 14 days after presentation. It is an exceptionally infectious malady that can be spread from individual to individual contact, respiratory beads that are discharged noticeable all around when somebody tainted hacks or wheezes, and conceivably by contacting a surface or article with the infection on it and afterward contacting your mouth, nose, or eyes. In any case, the CDC doesn't consider that last one is an essential way the infection is transmitted. In the vast majority, 80%, as indicated by a WHO report on China's cases, the side effects are gentle. Anyway, the risk for serious contamination is higher in those more than 65 and the individuals who are immunosuppressed or have previous well-being conditions like coronary illness, lung ailment, malignant growth, diabetes, and hypertension, just as the individuals who are smokers. While the infection itself might be mellow for most, the worry is that the spread of it will overpower our emergency clinics and human services suppliers, leaving specialists and clinical staff to confine life-sparing assets. Since the accessibility of tests for the infection in the US is insufficient, to say the least, numerous individuals are being encouraged to self-isolate on the off chance that they show the three primary side effects: fever, hack, and brevity of breath. They are additionally encouraged to abstain from going to clinics and critical consideration offices except if their indications become extreme. Another test has been propelled and endorsed by FDA. This test brings about only a couple of hours rather than not many days. The new test is currently being utilized in emergency clinic labs over the US to test for coronavirus. As you've most likely previously perceived, those are for the most part regular pointers of other, increasingly considerate diseases like the normal cold and influenza. Which means any individual who is symptomatic is quickly bouncing to most dire outcome imaginable mode and thinking they have COVID-19, however can't get tried to discover without a doubt. Also, as indicated by World Wellbeing specialists, we're just toward the beginning of the emergency here in the inn that clarifies why you see everybody from government authorities to big names and web-based life influencers begging individuals to remain inside and practice social removing with an end goal to stop the spread and attempt to contain the infection. What are the risks for those with incessant dysfunctional behavior? On the off chance that perusing those details caused you to feel apprehensive or frightened, duplicate that by 1000 and you'll start to see how this circumstance feels to those experiencing state of mind and character issue. The impacts of this emergency are more expansive than elevated tension, which basically everybody is feeling. There are likewise streamed-down impacts to those with dependence and social issue like OCD, ADHD, and substance misuse. Alongside the decency that social separating can accomplish for our own well-being and society when all is said and done, it additionally builds sentiments of disconnection, forlornness, stress, and dread, which can all be triggers that exacerbate numerous dysfunctional behaviors interminably. How does coronavirus influence the most widely recognized psychological instabilities? As indicated by our specialists, there are explicit concerns and difficulties with the coronavirus pandemic for every one of the 9 most normal emotional well-being conditions. While some cover, many are more explicit. Considering that, we requested that our board detail the need-to-know data for each, including the greatest difficulties, what you can do to oversee, and where to discover help. How does anxiety identify with the coronavirus? While there are numerous particular sorts of nervousness, one of the most widely recognized is generalized anxiety disorder, aka STRAE, which influences in excess of 6 million Americans. While it is entirely expected to stress, those determined to have GAD experience issues controlling concern on a bigger number of days than not for a time of more than a half year and have at least 3 normal side effects, having a relentless feeling of approaching fate or threat, being peevish and nervous, fast breathing, consistent trembling, feeling feeble or tired, experiencing trouble concentrating or difficulty dozing, and having an expanded pulse. For these individuals, the COVID-19 pandemic may make a raised dread of coming down with or passing on from the infection. Uneasiness victims are inclined to catastrophizing, which can bring about practices like frenzy purchasing or attempting various prescriptions and medications with an end goal to fix or forestall coronavirus. For the record, WHO and the CDC both express that there is as of now no known fix or demonstrated prescription for COVID-19. They can likewise succumb to urgently checking the news, looking over and looking for something increasingly conclusive that just won't come. On the positive side, the individuals who have been in treatment for a tension issue may really be more ready for the present circumstance as they as of now make them adapt components set up to manage their everyday feelings of dread. However, for a few, this could likewise be a tipping point that makes them deadened by that dread. Which is the reason our specialists stress that one of the most significant things those with uneasiness must do right presently is to perceive that there is nothing of the sort as having no dread. Eventually, we as a whole will fear something. How we react to that dread is the thing that will decide how we overcome this emergency. What are some adapting tips for anxiety? One adapting procedure to attempt is the thing that a few therapists call being with your dread. It includes recognizing what is right now causing your dread in a specific second, at that point recognizing that you and your body are as of now protected. Practice profound breathing and ground yourself in that relaxing. Psychological wellness and care applications like Headspace can be extraordinary spots to get guided reflection tips and procedures. It's likewise critical to remain for all intents and purposes associated, be that with your primary care physician, or loved ones. We are social animals ordinarily, and it's been indicated that social help cradles pressure and uneasiness. Have a go at assigning in any event one call a day to a totally non-coronavirus related discussion, concentrating rather on positive inquiries and stories. Furthermore, limit your media diet to abstain from going down the hair gap of awful news. Permit yourself to check in once in the first part of the day and once before supper, setting a clock for 15 to 20 minutes, and logging off when that alert goes off. Search for positive stories, not simply coronavirus refreshers. Numerous individuals may find that viewing the news can make them be progressively restless. On the off chance that you fall in that class, stick to understanding it. What's more, don't depend via web-based networking media to get your realities. It's essential to trust in the human services specialists that are checking and working non-stop on controlling this pandemic, not your mother's closest companion's neighbor who saw this thing that may shield you from disease. Sorry Susan, yet we're going to believe the CDC over that image in your Facebook channel. What are a few assets for anxiety? On the off chance that you wind up feeling overpowered and incapable to adapt, there are a lot of assets accessible. Numerous specialists and emotional wellness suppliers are setting up virtual practices to enable their patients to stay aware of their treatment. You can likewise look at the Substance Abuse and Mental Health Services Administration (SAMHSA) for recordings, treatment choices, and state-of-the-art data and projects that can help. Notwithstanding conversing with your primary care physician and friends and family, specialists likewise suggest joining a virtual care group around things like weaving or preparing or another pastime or point you appreciate. These can be a type of positive interruption, which is a key way of dealing with stress for those with nervousness. How does depression identify with COVID-19? While we as a whole have episodes of bitterness every now and then, for the 17.7 million individuals determined to have clinical gloom, that distress and misery is steady and accompanies different indications like weariness, inconvenience resting, a contracting craving or potentially gorging, abrupt crying spells, and now and again considerations of self-destruction. Similarly, likewise with nervousness, the dread and confinement can be exceptionally risky for those with sorrow, in light of the fact that without an outside impact to help them to remember the great, they may rather concentrate exclusively on the terrible news and build up a slanted feeling of the circumstance, and possibly not have the option to haul themselves out of that winding. Wretchedness victims may have a developing feeling of sadness or be deadened by the dread, driving them to disregard themselves and their well-being. Depression and dread can likewise be triggers for self-destructive contemplations. What are some adapting tips for depression? Which is the reason the two most significant strides for those with misery right currently are to concentrate on association and self-care. It's fundamentally significant, our specialists state, to contact your social associations with remind yourself you are not the only one. What's more, while it might appear to be senseless when you're stuck inside and not seeing anybody, having a day-by-day schedule of self-care can help guarantee you don't succumb to your most noticeably terrible driving forces. Get up, scrub down, get dressed, work out, cook your dinners, make everyday virtual dates with your loved ones. Your brain might be advising you to remain in bed and do nothing, yet this will just compound the situation. Another adapting aptitude is the thing that our specialists call counterfeit it to make it. Basically, read or watch or accomplish something that is something contrary to how you are feeling. Try not to turn on that ultra-tragic film since you are feeling down, put on something clever and happy. Concentrate on positive themes and occupy yourself from that dread and misery and forlornness. What are a few assets for depression? In the event that you wind up battling, make certain to inform your therapist or other mental medicinal services supplier and attempt and calendar meetings. National Suicide Prevention Lifeline is accessible 24 hours per day, 7 days every week. Converse with anybody in your system on the off chance that you are truly battling. Social association can help mitigate a portion of that depression or dread that might be making you think nonsensically or to follow dangerous motivations. Some nearby legislators are likewise calling for psychological well-being experts to offer free emotional well-being meetings via telephone or online to help any individual who may be battling at this moment. Go to the National Alliance on Mental Illness to scan with the expectation of complimentary help and instruction programs in your general vicinity. How does OCD identify with coronavirus? Over-the-top enthusiastic issue is a kind of nervousness issue that happens when an individual stalls out in a pattern of fixations and impulses. Fixations are viewed as any musings, pictures, or driving forces that repeat as often as possible and feel outside of your control to stop or oversee. Impulses are tedious physical practices or musings that somebody may use trying to cause their fixation to leave. A great many people with OCD can perceive that their impulses won't cause fixations to leave, however succumb to them as they give off an impression of being the main way they can adapt or get away. For those with OCD, explicitly those whose fixations and impulses that rotate around tidiness and germs, a worldwide pandemic is their most exceedingly terrible bad dream spring up. The CDC suggests hand washing and home disinfecting much of the time, yet that can be taken to the extraordinary by those with OCD. Rather than washing their hands for 20 seconds each time they've been outside or hacked and wheezed, they may end up scouring their hands crude under singing high-temp water for 20 minutes with an end goal to feel clean. Stress around the infection can likewise trigger impulses around tallying or checking things, as per our board. What are some adapting tips for OCD? Much the same as those with uneasiness, individuals with OCD need to deliberately peruse the guidelines and warnings from the CDC and WHO to realize what the suitable precautionary measures are that they ought to be taking and to what degree. For somebody with OCD, some portion of the treatment could be attempting to decrease practices like over-the-top washing, so during this specific emergency give yourself authorization to follow the rules, washing hands as often as possible as well as utilizing hand sanitizer, opening takeout compartments outside, sterilizing surfaces like light switches and remotes. Another angle that is special to somebody with OCD is trust. Individuals with OCD may not confide in their own appraisal of what's happening around them. They rethink their own responses. Here, it's essential to know, yes, this is a serious deal, and indeed, it is dubious and extraordinary. Too much news can make anybody begin to winding, however it's particularly significant for somebody with OCD to restrict their time. Truly, 5 minutes daily is all that is suggested. It is anything but a great deal, however going past that could get you snared. On the in addition to side, somebody with OCD has better than expected abilities for overseeing tension. They may really be progressively proficient at managing all the change all of us are battling with. What are a few assets for OCD? In the event that you are somebody who has been looking for treatment for your OCD, ensure you are utilizing those ways of dealing with stress you have learned vigorously and contact your primary care physician or emotional well-being proficient in the event that you discover your impulses are turning out to be exacerbated by the pressure. The International OCD Foundation is an extraordinary asset on the off chance that you need assistance finding a specialist or in the event that you are searching for a care group to help get you through this difficult time. Having the option to talk with others additionally managing your equivalent battles can be useful in adapting and diminishing your scenes. How does substance abuse disorder identify with COVID-19? A very normal issue that influences a wide range old enough, race, and financial gatherings. Substance misuse issue is an ailment that influences the mind and standards of conduct, making an individual be not able to control the utilization of addictive substances like liquor, tobacco, illicit medications, and professionally prescribed drug. Numerous individuals with a substance misuse issue likewise experience the ill effects of another type of psychological maladjustment, more than 9 million grown-ups, as indicated by the latest information from NAMI. The huge worry for those in treatment for substance misuse is the danger of backslide. A large number of those in treatment for substance misuse depend on everyday gatherings or care groups like Alcoholics Anonymous. As our specialists note, while fixation is treatable, nobody can recuperate alone. With disengagement and lockdown set up, numerous individuals can't get the help they have to help fight their inclinations. What are some adapting tips for substance abuse disorder? For those that are battling, see somebody promptly as a recuperation coach. This could be a support, a recuperation mentor, or a specialist. Associate with them as much as could be expected under the circumstances or as much as you might suspect you have to, yet be certain you are discussing what substance misuse specialists consider the 4 significant purposes of association each time. Everything that is continuing, everything that you are feeling, everything that you are thinking, and everything that you are doing at that time. In the event that you end up having expanded longings, you have to converse with somebody, a companion, a friend or family member, anybody you fondle happy with opening to, regardless of whether that implies considering a renewed individual at regular intervals. Whatever you can securely do to evade the seclusion that could prompt a backslide. Also, substance misuse specialists suggest giving yourself day-by-day talks to remind yourself what capitulating to your longings will result in. Converse with yourself about everything great that will occur in the event that you don't someone who is addicted and everything awful that will occur on the off chance that you do. Ask what is setting off the hankering and what you can do to help calm and occupy yourself. Things like ordinary exercise, perusing a decent book, playing a computer game, and getting another diversion would all be able to be useful interruptions. What are a few assets for substance abuse disorder? Gatherings like In the Rooms, self-management and recovery training, and Alcoholics Anonymous all give accommodating projects and online care groups to help those with substance misuse issues and assist them with exploring their dependence remotely. How do eating disorders identify with the coronavirus? There are 3 primary sorts of dietary issues: anorexia nervosa, bulimia nervosa, and voraciously consuming food issue. Individuals with anorexia will in general be fixated on their weight, definitely confining their calorie admission and outrageous measures of working out, continually thinking they are overweight in any event, when they are in truth hazardously underweight. For those with bulimia, their confusion is embodied by times of wild voraciously consuming food, trailed by a vibe of being agonizingly full and the need to cleanse, trying to redress or dispose of the calories they currently feel regretful for devouring. Gorge eaters will likewise encounter that equivalent inclination to eat and failure to control the amount they eat, however they don't work on cleansing or calorie limitations post-gorge. For those with dietary problems, the primary concern is around the apparent dread of absence of provisions. Those with a dietary problem may accept they have to accumulate nourishment because of the reliably unfilled racks they see at the market. They may likewise discover motivation to blame these non-existent nourishment deficiencies so as to deny themselves of nourishment as a type of proportioning. What are some adapting tips for eating disorders? It's significant for those with dietary problems to perceive that notwithstanding the void racks they might be seeing, the USDA and nourishment makers have guaranteed Americans that there are not at present any nourishment deficiencies or interruptions in the nourishment production network. The void racks are a consequence of frenzy purchasing and representatives incapable to stock retires sufficiently quick to stay aware of interest. While guaranteeing you have enough nourishment to last you on the off chance that you do confront a self-isolate is a shrewd choice, that just compares to around 14 days of nourishment. Attempt and spotlight on purchasing new veggies and organic products, entire grains, lean protein, and nourishments plentiful in calcium and nutrient C. Taking nutrient D to make up for absence of introduction to daylight is likewise energetically suggested. What's more, while practicing every day is a solid decision, don't take it to the extraordinary. Focus on 20 to 30 minutes of moderate exercise, not 3 hours of serious cardio. What are a few assets for eating disorders? On the off chance that you feel anxious or that you may be slipping into hazardous examples, contact a dietary advocate or your primary care physician to talk through your interests. You can likewise discover online help from the National Eating Disorders Association, Eating Disorder Foundation, and National Association of Anorexia Nervosa and Associated Disorders. Like substance misuse, dietary problems are a type of habit, which means it's critical to keep in touch every day with somebody to help bolster your recuperation and the board of your fixation. How does ADHD identify with COVID-19? Consideration shortage hyperactivity issue, usually known as ADHD, is a social issue that makes somebody experience the ill effects of heedlessness and trouble centering, alongside hyperactivity, squirming, and motivation control issues. While the vast majority relate ADHD to youngsters, numerous grown-ups additionally experience the ill effects of ADHD, which can prompt significant interruptions in their day-by-day life. This can incorporate everything from work execution to connections. One of the principal issues for those with ADHD who are stuck at home during the COVID-19 flare-up is an extreme decrease in efficiency. With the vast majority telecommuting and numerous organizations having to lay off rates of their workforce, presently isn't an ideal opportunity to look as though you are loose and at work. Another worry our specialists have is that, because of their powerlessness to concentrate or keep focused, a few patients with ADHD will most likely be unable to follow the severe rules for ensuring you and your friends and family against the spread of contamination. ADHD patients may neglect to wash their hands as often as possible or think that it's difficult to remain inside. What are some adapting tips for ADHD? In the event that you have ADHD, specialists can't pressure enough the significance of setting an everyday calendar and adhering to it. Getting up simultaneously every day and following a set example can assist you with keeping up your focus and continue being gainful and responsive at your particular employment. It's alright to take breaks, as long as you structure them to incorporate set exercises for a constrained measure of time, no looking on Instagram for 2 hours when you ought to review that TPS report. Make certain to rehearse self-care, including everyday workout. In the event that you need direction, numerous exercise centers have changed to web-based spilling of their classes, or you can look at wellness applications like Wellbeats or Down Dog. On the off chance that your youngster has ADHD and generally has the help of a facilities in school, you can attempt to duplicate that at home by separating assignments into short meetings, maintaining a strategic distance from excess undertakings, and keeping guidelines basic and direct. A couple applications that merit looking at: Dreambox for math, Flocabulary for vocab, and Irrawood charts to follow progress. What are a few assets for ADHD? On the off chance that you have a feeling that you can't effectively deal with your ADHD during this emergency, connect with your psychological well-being proficient for direction, or check in with associations like Children and Adults with Attention Deficit, Hyperactivity Disorder (CHAD) and Attention Deficit Disorder Association (ADA) for virtual companion bolster gatherings and supportive tips. How does bipolar disorder identify with the coronavirus? Bipolar turmoil, earlier known as hyperburdensome disease or hypergloom, is a psychological wellness issue where individuals experience two particular sorts of extraordinary passionate movements recognized as hyperscenes and burdensome scenes. At the point when somebody is having a hyperscene, they experience what are considered up times of feelings that incorporate crabbiness, volatility, joy, and being empowered. These are at times followed by down periods described by bitterness, detachment, and sadness. Like uneasiness and sadness, the pressure and dread brought about by COVID-19 can trigger these unusual practices, explicitly hyper scenes, which would then be able to be followed, despite the fact that not generally, yet extreme burdensome scenes. What are some adapting tips for bipolar? As indicated by our star board, one of the most supportive things you can accomplish for yourself at this moment, notwithstanding self-care and day-by-day associations with loved ones, is to self-screen your propensities by keeping a journal or diary. Give specific consideration to your rest, as a disturbance in those daily examples is a key marker that you may be encountering more scenes. It's additionally critical to request that friends and family monitor you, for all intents and purposes, as they are bound to have the option to recognize social and state of mind shifts. On the off chance that that is the situation, talk with your specialist or whichever specialist deals with your solution to consider adjusting your prescription levels. What are a few assets for bipolar? For help, look to SAMHSA and NIMH for every minute of everyday helplines, just as care groups like the Depression and Bipolar Support Alliance. How does schizophrenia identify with COVID-19? Mind flights, dreams, and impeded conduct are for the most part indications of schizophrenia, an emotional well-being infection that outcomes in individuals being not able to decipher reality typically. They can act and talk whimsically and may experience difficulty imparting or controlling a few developments. They are likewise inclined to self-destructive musings. For a large number of us, this unusual new world we're living in due to COVID-19 can feel like a type of exchange reality. For those experiencing schizophrenia, it makes a hazardous circumstance, as their view of reality would already be able to be distorted. Individuals who have schizophrenia and can effectively work in their locale in all likelihood can do as such through prescription, a normal everyday practice, and a variety of help that could incorporate doctors, case managers, and friend gatherings. With COVID-19, the entirety of this has been upset and they are presently in a position of separation that could make them a peril to themselves. In the event that you are somebody effectively inclined to see the world through a distrustful focal point, you may accept the deception about coronavirus that is flowing, or even be searching it out to help make the news fit your adaptation of the real world. What are some adapting tips for schizophrenia? Our specialists stress that keeping up everyday registration with your primary care physician and, if conceivable, case manager, is totally a need in ensuring you don't become focused on daydreams or mind flights that may rise because of expanded pressure. Once more, having a set everyday schedule is significant in guaranteeing you are keeping some similarity to regularity in your life during this topsy-turvy time. What's more, keeping up your ordinary drug is pivotal, so make certain to keep steady over your medicine tops off and don't hold up to the last moment to get them filled. What are a few assets for schizophrenia? On the off chance that you are having self-destructive considerations, call the National Suicide Prevention Lifeline and contact your emotional wellness supplier right away. How does post-traumatic stress identify with coronavirus? For any individual who has been presented to a sort of injury, post-horrendous pressure (PTS) is a typical condition that can happen. It is most normally connected with military veterans, but at the same time is something that can occur after awful accidents that go from vehicle accidents and catastrophic events to sexual maltreatment survivors. Side effects of PTS incorporate remembering the occasion, aka flashbacks, bad dreams, keeping away from specific spots or exercises that help you to remember the injury, distrustfulness, segregation, and hyperawareness. What are some adapting tips for PTS? As per our specialists, individuals with PTS will in all likelihood not be excessively seriously affected by coronavirus, as most of their side effects are activated by things that help them to remember the awful accident. All things considered, stress can make you become enthusiastic and frightful, particularly on the off chance that you are as yet preparing the occasion. One activity is reframe what a decent day implies for you. In these questionable conditions, some level of pressure and tension is ordinary and anticipated. Feeling of authority over things may help. Consider what you can do and set basic objectives. Musings of getting the infection may make you feel focused and may make you partner the infection with the awful mishap that caused your PTS. You may discover you make some harder memories. Dozing and focusing is increasingly troublesome due to this affiliation. What are a few assets for PTS? The National Center for PTSD is an extraordinary asset on the off chance that you are searching for help interfacing with an expert who spends significant time in PTS. It additionally gives some supportive self-adapting techniques to utilize on the off chance that you are feeling overpowered and can't talk with somebody quickly when indications show up. Realize that for some with this condition, you can't generally get away from the things that trigger you. Anyway, having the option to distinguish those triggers can assist you with bettering oversee and figure out how to confront your dread. What would you be able to do to assist a friend or family member with mental illness now? In the event that you know somebody with a psychological sickness, this is the ideal opportunity to step up and ensure you are helping them in the manner you can. Connect, be it through video, telephone, content, or web-based life, to registration and be a functioning piece of their care group. Numerous individuals accept that when managing a friend or family member who has a psychological instability that they should have the option to think of an answer for their concern. That can make us dreadful about saying an inappropriate thing or not having the option to give supportive counsel and fix them. Rather, connect with the goal of telling them that you are there and needing to know how they are. Disclose to them you've been contemplating them and truly ask how they are getting along. Keep in mind, says our primary care physician board, that the straightforward demonstration of associating with another individual can be life-sparing. Thanks for watching. Don't forget to like, comment and subscribe for more information, tips and advice from Wellness World.